Understanding obstructive sleep apnea. In this educational video, you will learn about a common breathing disorder called obstructive sleep apnea. You are watching this video at your doctor's request or because you want to learn more about this life-threatening disorder. Please, pay close attention to the information in this video and how it can help you. First, let us look at what is known as normal airway breathing. This is the normal position of your airway when you sleep. Notice that air enters through your nose and mouth and passes through the airway unrestricted and freely. Next, let us look at narrow airway breathing. The narrowing of the airway causes a vibration sound called snoring. Snoring happens when we are very tired or when the airway is smaller than it normally would be during sleep. Now, you may be saying to yourself, everyone snores, right? So why should I be concerned? Not everyone, but it is estimated that over 80% of Americans snore. Most cases could be an undiagnosed sleep breathing disorder. This could be undiagnosed obstructive sleep apnea. The final type is obstructed airway breathing. This type is also known as obstructive sleep apnea. Obstructive sleep apnea, or OSA, is a common breathing disorder that causes the lower airway to collapse and become blocked, causing airflow to completely stop. How serious is obstructive sleep apnea? Obstructive sleep apnea causes a person to stop breathing for a few seconds to minutes and may occur up to 30 times or more an hour. This can cause your body and its organs, especially your lungs, heart, and brain, to be deprived of needed oxygen. This lack of oxygen can cause other long-term health conditions. Obstructive sleep apnea is a chronic, ongoing condition that disrupts a person's sleep cycle with long-lasting negative effects on their overall health that can even cause early death. Premature death can be caused by many unhealthy habits and health conditions such as smoking or diabetes, to name a few. But untreated obstructive sleep apnea can shorten your life by as much as 8 to 12 years. Obstructive sleep apnea can even increase the risk of premature death by 46%. On the left side of this chart, you can see some of the common symptoms of obstructive sleep apnea. A few of them are depression, forgetfulness, headaches, daytime sleepiness, snoring, dry mouth at night and in the morning, and choking or gasping for air while you sleep. Are you presently experiencing any of these warning signs? On the right side of this chart, you can see the most common comorbidities related to obstructive sleep apnea: ADHD, stroke, diabetes, heart failure, irregular heartbeat, high blood pressure, acid reflux, obesity. Please take note if you are presently suffering from any of these life-threatening health conditions or have a family history. Now let's take a look at the two most common treatment therapies for obstructive sleep apnea. One of the common types of treatment is CPAP, or continuous positive air pressure. This therapy can be effective, but patients can sometimes be non-compliant with this therapy. CPAP therapy can have compliancy issues such as the air pressure makes it difficult for some patients to breathe, limiting for the patient due to face straps and hose, can cause a claustrophobic feeling, continual maintenance and cost to maintain, constant cleaning issues, and a risk of respiratory infections due to system bacteria buildup. The other common therapy for obstructive sleep apnea is oral sleep appliance therapy. An oral sleep appliance is much like a retainer or night guard. It gently shifts the lower jaw forward and opens the lower airway. The picture on the left demonstrates a blocked airflow by a collapsed airway causing obstructive sleep apnea. The picture on the right of the screen demonstrates how the oral sleep appliance moves the lower jaw slightly forward, reopening the airway and treating obstructive sleep apnea. To determine if you are at risk for obstructive sleep apnea, you will need to have a sleep test. The two forms of sleep testing are polysomnography, PSG, and a home sleep test, or HST. In order to diagnose all types of sleep disorders, a patient may undergo polysomnography, also called a sleep study. These are typically done in a sleep lab, require an overnight stay. Testing is done for all types of sleep disorders, and the costs range from $2,800 to $4,000. Your dentist and their team can provide you with a home sleep test. This test is self-administered in your home, allowing you to spend the night in your own bed at a lower cost. The cost of a home sleep test ranges between $200 to $300. This type of testing is specifically for diagnosing obstructive sleep apnea. Now that you have a better understanding about obstructive sleep apnea, please contact your dentist and their team to be screened and to be scheduled for a home sleep test. Your dentist and their team are professionally trained and experienced in helping people with obstructive sleep apnea. Thank you for watching this presentation. Please understand that obstructive sleep apnea is a very serious life-threatening disorder. If sleep testing determines that you have it, you should be treated as soon as possible. The good news is that your dentist and their team can help you.